Hi, I'm Wayne Smith, President and CEO of the Delaware Healthcare Association, and welcome again to Delaware Health Forward, our quarterly update focused on innovation in healthcare in Delaware. Today, I'm pleased to welcome from Bayhealth Dr. Gary Siegelman, their Chief Medical Officer and Senior Vice President, to focus on the future of their graduate medical education programs and what they mean to Delaware. Gary, always nice to see you. Welcome.
Nice to see you too, Wayne. Thanks for having me.
You bet. Let's start right in. I understand before we begin talking about GME programs that Bayhealth has just received another accreditation. Would you like to share with the audience what that is?
Yeah, absolutely, Wayne. I'd be happy to. Yeah, we are proud of the work on rectal cancer that's been done by a team of physicians and clinicians and staff at Bayhealth. Rectal cancer is an important illness. It affects about 50,000 people a year in the U.S., new cases in the year, per year, and it has fairly complex processes to really treat it well, so you have the best possible cure rate and outcomes. So for that reason, several years ago, a national standard of best practice was created for rectal cancer care by the American College of Surgeons. And it's got a long name. It's called the NAPRC, which is the National Accreditation for Program for Rectal Cancer. And we put together a team over the course of a few years, which was surgeons, oncologists, pathologists, nurse experts, to meet the exacting standards of this organization. And basically, very briefly, the care involves using proven practices in all phases of care of the rectal cancer patient. So it includes the surgery, the way the tissues are assessed, the imaging and staging studies, and so forth. And we were very pleased after several years of work. We did receive the accreditation in just this year in 2022. And that certifies that we're meeting all the high standards. It is a tough accreditation. We're the first health system in Delaware, and actually one of the first 50 in the nation to receive this accreditation. Again,
Congratulations. I know it took a lot of hard work on your team to make that happen, and it's certainly going to be a boon to those who receive health care in Kent and Sussex County. So I think it's really great news for the folks that we all serve. Well, let me dive right into the graduate medical education program. If you could just give a brief overview to folks who are not necessarily clinically involved, why Bayhealth decided to launch its GME program, but also I understand that it's growing and off to a vigorous start. But in the last 3 days, you've just added a new accreditation to the lineup, and congratulations on that.
Thanks, Wayne. Absolutely. So yeah, just stepping back to give a little bit of an overview. Graduate medical education and undergraduate medical education are training. GME, or graduate medical education, is training new physicians that are pretty much freshly minted out of medical school and training them in a 3 to 5 year residency to help them develop the specialized skills that they're going to use for the rest of their lives in practice. So you can train surgeons, you can train emergency medicine physicians, primary care, et cetera. So that's one set of programs. And another one is what we call undergraduate medical education, which is really doing the training for medical students in their 3rd and 4th years when they're doing their clinical rotations. They're really starting to learn in terms of patient care hands-on. So the medical staff and our CEO and our board, Bayhealth overall, made the commitment in 2018 to pursue both of these lines of education. And we began our programs. Our first 2 programs began actually last July. And again, it's several years of preparing, but they opened with a total of 20 residents last July 1st in internal medicine and family medicine, which are primary care specialties, as you know. So that's kind of an intro to what we're doing and how it began.
And then I understand you just got within the last 3 days an accreditation that will add to your offering.
That's correct, Wayne. So we heard on Tuesday, actually, that we've been accredited by what's called the ACGME. That's a national body that accredits residency programs, that we received accreditation for an emergency medicine residency. We're actually one of only 3 in this year thus far that's received accreditation for emergency medicine without any citations or things that we need to fix. So we're very happy about that.
Congratulations. The Bayhealth team has certainly been busy, and it's a very nice achievement. I want to focus a little bit on what your new programs and offerings mean to primary care in Delaware. You know, that's been a challenge for us here in this state, all over the state, really. But how will this help address the primary care shortages and challenges we have in our state?
Sure. So as I mentioned, Wayne, the first two programs we began last July are primary care programs, family medicine and internal medicine. And everyone knows those are the types of doctors you need when you have a number of, general medical issues and to care for you overall over time. Um, because we'll be graduating 21 new physicians from that program every year, we'll have 21 per year total between those two programs. So every year over this 3-year program, we'll be graduating over 20 new residents in primary care. And the idea is that will allow, we'll be able to get physicians that come into the community that hopefully settle and continue to work in Kent and Sussex counties for the long term. While those residents are here, they'll actually be providing combined between the two ambulatory clinics about 40,000 additional patient care visits per year. So we have for family medicine an office where the young residents are working to take care of patients directly, and the same for internal medicine. So they're providing a lot of care just in those residency clinics that they're working in.
So if you look at 40,000 over the population of both Kent and Sussex counties, your service area, that's a significant augmentation of primary care availability for the folks you serve.
Right. That's the number of visits, Wayne, and so
Mhm.
it's going to be fewer patients, but it does
Sure.
help, and it makes it a little bit easier for people to get in sooner to see a primary care physician.
And could you talk a little bit about what this program, and particularly with the emphasis on the primary care training, is going to mean to patients in your service area? I know there's some statistics out there and data that shows that people who do a residency in an area are more likely to look at that area upon graduation or upon finishing their residency in terms of setting up practice.
That's correct, Wayne. So there has been some training programs and residencies in Delaware before, but just in Newcastle County. So we've now brought in for the first time the training in Kent and Sussex counties. And you're correct that there's a high percentage of residents when they finish their last year of training, and now they're looking for a long-term job, that stay very close within 20 to 30 miles of where they trained. And so just by having people be here in Delaware, they get to know the community, they build relationships, and that, I think they'll enjoy what they see here and what they experience. Our goal is to have many of them stay and take jobs in primary care, particularly in Kent and Sussex counties. And so that's a big piece of trying to increase the supply of physicians that, our community wants to see.
I know that rural healthcare is a challenge all over the nation, not only in Delaware. And although rural is a primary designation for Kent and Sussex, certainly access to primary care is different depending on whether you're near a town or a city in those counties versus some of the areas that are more typified as rural. Can you focus a little bit and comment on what this means to access in the most rural areas of your service area?
Well, we're one of the health systems that's been trying to help provide more care in Sussex County, which is rural, but Kent is also considered an underserved area as well, Kent County. And so many physicians want to have an established practice they move into. Those exist in those two counties with our health system, and others have those types of practices. We are very focused on getting physicians close to patients, in an office that's close to people, Delaware's not huge, but you also don't want to travel. People don't want to travel a large distance. So I have people throughout Sussex and throughout Kent counties, physicians that our patients can see. We did focus on in the family medicine residency that had a lot of focus on rural care. So that is part of the training. And in part because of that, we received a grant from the federal government when we started to support training residents in elements of rural healthcare. So we have somewhat of a focus on that, and that's going to help us, our residents, and hopefully the community.
Well, that is really exciting. And I know in addition to Bayhealth's existing and growing program that BB Healthcare is planning to launch a residency program. And Nanacoke, I think, will move a couple of slots up from the existing program that's in Salisbury. So that it really good news being led by Bayhealth, of course, for our two most southern and rural counties in terms of access to care. So it's really exciting. I'd like to ask you to talk about the effect of uh, your program on the Dimer program. As a lot of folks know, and particularly policymakers, could be looking at this. Dimer is an existing program that provides access to medical education for Delawareans in lieu of having our own college, our own full college, medical college.
Right.
And certainly the Dimer program is, we'd like these people to come back to Delaware. They don't always. But what is the likely effect of this program that Bayhealth is standing up and growing on the ability and likelihood of Dimer students to return to the state which bred them?
Sure, of course, Wayne. So first, yeah, to talk about Dimer for 1 minute. I mean, the state has had foresight and made the investment to partner with PCOM and Jefferson over the years to give these Delaware students a chance to go to medical school and have that connection. The issue is when they finish medical school, if there aren't residencies in Delaware, as we talked about a few minutes ago, they're less likely to form those longer term connections where they're going to work long term. So um, by having the schools in Philadelphia that Delaware students, residents can go to, excuse me, Delaware medical students can attend, and then having the residencies here in Delaware, it gives them that full spectrum. They get trained close to Delaware, they come back for their residency in Delaware, and then it allows them to really see how practice would be here. And again, many of them enjoy it. They're from Delaware, they want to stay close to home. So we're not letting them run off to a residency in New York State or somewhere else where they might settle down and not come back. So that's part of the goal in doing this.
It's really, brings to culmination the strategy of having Dimer and allowing our young people who didn't have access to a medical college in state to have that full medical college experience, but also hopefully bring him back home. So that's it's been a long and missing part of our strategy as a state, but I think it's going to benefit Delawareans for years and years to come. Is there anything, Gary, that I'm missing that you'd like to add or focus on in terms of what Bayhealth is doing with GME?
Well, I'll just mention briefly a couple things. One is our reasons for starting GME were we've already talked about one of them, which is to really help bring in a greater pool of physicians to Delaware, particularly Kent and Sussex counties for the future. But it's also helped us do a couple other things. One is that it's enhanced our learning environment and our interest in doing some clinical research. And it's also helped us bring in some really talented people who are faculty and nurses that like being in an academic setting. So we have um, and to train our current medical staff members that want to learn to be more involved in teaching. And again, you can get talented residents and you get talented people to train them, and it's really a positive cycle, each reinforcing the other. So that's very important. And we've put a big investment into it, both in terms of people and facilities. And it's a very important thing for us. And again, we're happy that it's going to benefit our organization and the community in particular.
Well, again, wonderful news and exciting for the folks we all serve in Delaware, and particularly those in your service area. Dr. Gary Siegelman, Chief Medical Officer at Bayhealth, I want to thank you for your time and sharing your insights with these exciting developments with our audience. This is Wayne Smith for Delaware Health Forward, and until next time, thank you for viewing.
Thanks, Wayne.